What happens when uncontrolled blood sugar meets a woman's body? The answer might surprise you. From mysterious dark patches appearing on your skin to infections that just won't quit, your body could be waving red flags you never knew about. In the US, around 15 million women have diabetes, which is roughly 1 in every 9 adult women. The prevalence of diabetes can differ based on age, race, ethnicity, and other factors. In today's video, we will explore 10 hidden signs of diabetes in women, revealed in ways doctors rarely discuss. And number 4, it's probably happening right now to millions of women who have no idea what it means. Stay tuned to discover why fatigue isn't just about being tired and learn the unexpected connection between sugar and one of the most common female health complaints. This isn't just another health video. It's potentially life-changing information every woman needs to know. Whether you're 25 or 55, these signals could be hiding in plain sight. Don't miss what could be the most important health video you'll watch this year. Please show your support by liking this video and hitting the subscribe button. Do you have diabetes? What part of the world are you watching from? Leave your comment below. Let's look at 10 common diabetes signs in women. Each one by itself might not mean much, but together they paint a picture worth paying attention to. 1. PCOS, polycystic ovary syndrome. PCOS might be the most peculiar warning sign of diabetes because it's both a sign and a risk factor. Think of it as a yellow light that's flashing before the red. Women with PCOS often have cells that don't respond well to insulin, which forces their body to produce more of it. This extra insulin then causes their ovaries to produce more male hormones, creating a cycle that's hard to break. The fascinating part is how this connects to diabetes.
The same insulin resistance that causes PCOS
also increases the risk of type 2 diabetes. 2. Frequent urination. This sign seems obvious, but it's often misunderstood. When there's too much sugar in your blood, your kidneys try to filter it out, which requires more water. It's like when you're trying to dilute something that's too concentrated. You need to add more water. This leads to making more frequent trips to the bathroom, which then makes you thirstier, creating a cycle that can be one of the earliest signs of diabetes. 3. Recurring yeast infections. Here's something they don't teach you in health class. Yeast love sugar. When blood sugar levels are high, some of that excess sugar ends up in places where yeast can thrive. It's like accidentally creating the perfect environment for bread to rise, except it's happening in your body. Women with uncontrolled blood sugar often find themselves dealing with stubborn yeast infections that keep coming back. One yeast infection isn't a reason to worry about diabetes, but if they keep happening, especially if they're hard to treat, your body might be trying to tell you something about your blood sugar. 4. Frequent UTIs. Urinary tract infections have an interesting relationship with diabetes. High blood sugar makes your urine more sugary, which is basically like laying out a feast for bacteria. It's similar to leaving food out on the counter. Eventually, something's going to grow there. For women with diabetes or prediabetes, this can mean getting UTIs more often than usual. The sugar in the urine creates an environment where bacteria thrive, making infections more likely and harder to clear up. 5. Dark skin patches. This sign has an interesting name. Acanthosis nigricans. It shows up as dark, velvety patches of skin, usually in body folds like the neck or armpits. It's fascinating how this works. When your body is producing too much insulin, often because it's not using it efficiently, this excess insulin can cause skin cells to reproduce faster than normal. The result is these distinctive patches. They're like a visual signal that your body's insulin system is working overtime. 6. Numbness and tingling. The connection between diabetes and nerve problems is like a slow-burning fuse. High blood sugar gradually damages nerve fibers, especially in the hands and feet. Women might notice reduced sensation or strange tingling feelings. It's particularly sneaky because it often starts so gradually you might not notice it at first. Think of it like a radio slowly losing its signal. At first, you hardly notice the static, but eventually it becomes impossible to ignore. 7. Unusual fatigue. Fatigue from diabetes is different from normal tiredness. When your cells can't use sugar properly for energy, it's like having a full tank of gas but a broken fuel line. You've got the energy source, but your body can't use it effectively. This kind of fatigue persists even after a full night's sleep. It's not the kind of tiredness that goes away with rest. 8. Vision changes. The way diabetes affects vision is particularly interesting. High blood sugar can actually change the shape of your eye's lens by drawing fluid into it. It's like what happens when you put a dried sponge in water. It swells and changes shape. This can make your vision blurry, and the changes might come and go as your blood sugar levels fluctuate. Many women first notice this when they suddenly have trouble reading, or their glasses don't seem to work as well as they used to. 9. Decreased libido and fertility problems. Decreased libido and fertility problems can be significant signs of diabetes in women, even though they are not always immediately associated with the condition. Diabetes can cause hormonal imbalances that disrupt the production of sex hormones like estrogen and testosterone, which play crucial roles in sexual desire. Additionally, chronic fatigue and emotional challenges such as stress or depression, common in people with diabetes, can further contribute to a diminished interest in sexual activity. Neuropathy, a complication of diabetes that affects nerve function, may also reduce genital sensation, adding another layer of difficulty. Fertility issues are another potential complication of diabetes in women. High blood sugar levels can interfere with the regularity of the menstrual cycle, making ovulation unpredictable or even halting it entirely. 4. Women experiencing decreased libido or fertility issues. It is essential to consider diabetes as a potential underlying factor, particularly if accompanied by other symptoms such as frequent urination, excessive thirst, or unexplained weight fluctuations. Consulting a healthcare provider is crucial for diagnosis and management, as effective blood sugar control and targeted interventions can often improve both reproductive health and overall well-being. Before we continue, I've got some exciting news to share. If you want to get more engaged, I'm excited to inform you that we now offer channel membership. As a member, you'll pay a small monthly fee and unlock some amazing perks like early access to new videos, priority replies to your comments, members-only shorts, polls, quizzes, and special emojis and loyalty badges just for you. It's a fantastic way to support the channel and connect with us even more. Just click the join button and let's make this experience even better together. 10. Candida infections. High blood sugar levels, hyperglycemia, can create favorable conditions for fungal growth in the body. The Candida fungus, when overgrown, commonly causes infections in the vaginal and oral areas, conditions often referred to as thrush. Vaginal Candida infections typically present with several uncomfortable symptoms. Women may experience persistent itching in the vaginal area, notice unusual discharge, and feel pain or discomfort during intercourse. The affected area often becomes sore and irritated. In oral Candida infections, the most noticeable sign is a characteristic white coating that develops on the tongue and along the inner surfaces of the mouth. This coating can sometimes be scraped off, revealing reddened tissue underneath. The link between blood sugar and Candida growth highlights why people with diabetes or other conditions affecting blood glucose control may be more susceptible to these fungal infections. Managing blood sugar levels effectively can help reduce the risk of developing these infections. How to treat diabetes. While there is no cure for diabetes, effective management can control symptoms and reduce complications. Women may face unique challenges, such as the impact of certain birth control pills on blood sugar levels. Consulting a doctor about low-dose options can help address this issue. Medications play a key role in diabetes management. Insulin therapy is essential for type 1 diabetes, while metformin is commonly prescribed to lower blood sugar levels. Newer medications also offer targeted options, and your doctor can help determine the best treatment for your needs. Lifestyle changes are equally important. Regular exercise, maintaining a healthy weight, avoiding smoking, and following a balanced diet rich in fruits, vegetables, and whole grains can improve blood sugar control. Working with a dietitian can help create a personalized eating plan to meet your health goals. Alternative remedies, such as supplements like chromium or magnesium, and herbs like fenugreek may offer some benefits. However, always consult your doctor before trying these, as they could interact with existing treatments. Combining medical care with healthy habits ensures better diabetes management. The interesting thing about all these signs is how they connect to each other. Each one makes a certain kind of logical sense once you understand what's happening in the body. High blood sugar affects everything from your nerves to your immune system to the way your cells reproduce. Recognizing the signs of diabetes in women is vital for timely intervention and effective management. Women should remain attentive to these symptoms and seek guidance from healthcare professionals as soon as they appear. Early detection plays a key role in controlling diabetes and reducing the risk of developing serious complications.
Are you experiencing any of these diabetes symptoms?
Leave your comment below. If you found this video helpful, please type yes in the comments below. I also encourage you to check out these 2 videos we selected especially for you. Thanks for watching.